Hello friends, welcome back to my channel Psychology Point. Today I am going to make you revise Chapter 5 Therapeutic Approaches Class 12 Psychology for your Term 2 exam, which is scheduled on 15th June. Okay, so let's get started. So, in this, first thing that you should know is psychotherapy. What is psychotherapy? That is a voluntary relationship between the client and the therapist. That is, the one who is giving the therapy is called therapist, and the one who is gaining the therapy or gaining the treatment is called the client. Okay, so what is psychotherapy should be clear to you. Then next thing in this chapter that you should know is about the aims. What are the aims of the psychotherapy which is given to the individual? Naturally you can write so many points in this. Few I had put it on this which are discussed in your NCRT, because when you will be writing your board papers, the key words should be, or for the answers should be taken from the NCRT only, and they should be highlighted. If you present your answers like this point wise or in flow charts, it would be good. Now, see, first let's discuss the aims of psychotherapy. Whenever we are giving any person therapy, that means he is having some problem with his in dealing with his emotions. So when we give him therapy, the aim would be lessening the emotional pressure or modifying his habits, or even on when a person is not able to get on his path properly, is not able to go for success, he is not able to, is not knowing about his or her own potential, then for increasing his self awareness, for unfolding the potential for positive growth, the therapy is given. Then for improving interpersonal relationship and communication. The next that you should know from the examination point of view is what are the characteristics of psychotherapy. See, first is systematic application of the principles. Whichever therapy a person is using, he should have scientific knowledge of it. He should be well trained in it. Second point is trained individual can practice. It is not that you and I can indulge in any therapy, maybe it is psychodynamic or maybe cognitive behavioral therapy. We cannot until and unless we are trained in it. Then it also involves therapist and the client interaction, of course, because before this therapeutic alliance is made, the therapy cannot be successful. We will be talking about therapeutic alliance later on in this video. Then of course the therapeutic situation, if the situation also is to be there in which the one is seeking the therapy and the other is ready to give the therapy. Okay. Therapeutic alliance, the two components of therapeutic alliance are contractual nature and limited duration of the therapy. Then of course the characteristics of the therapeutic alliance would include a trusting and confiding relation between the client and the therapist. Then therapist should have positive regard for the client. He should not be non-judgmental, he should be empathetic. And please, the next question which is most expected is how is empathy different from sympathy? I hope you all know sympathy is only showing pity, whereas empathy is putting others in one's putting oneself in other person's shoes. And then of course confidentiality is to be maintained. Only therapist should not discuss here and there that Mr. X came to me and was discussing all this with me. Okay, so that is an ethic also, which we will be discussing just now. Now next topic which I can take, I had divided the chapter therapies I will be taking in detail in the next part, and in this part I am discussing these topics which are smaller, which can be discussed faster and as a part of revision. So now factors in healing. See, whether the therapy would be successful or not depends on many factors. And whether the healing would take place in the individual or not. See, techniques which the therapist is first point in this is the techniques which the therapist is adopting. Okay, it should be in accordance with the problem of the individual. For example, if the problem is related to faulty learning, then behavioral techniques should be adopted. So if it is done accordingly, the healing will be affected, and the implementation also of the same by the client. For example, that means the client also should give equal equal cooperation, that whatever the therapist is telling him, he should do it. The same way, like a physician gives you a medicine and you don't eat it, then he cannot be he cannot be sure whether you will be okay or not. Same here also. Then of course the second thing on which the healing depends is how good is the relationship between the client and the therapist, that is the therapeutic relation. Then catharsis, of course, if the catharsis or emotional unburdening has taken place successfully or not, on that also the healing will depend. Then non-specific factors also, like whether the client, these can be client related also, and these can be therapist related also. See, if the client is not motivated for changing himself, then it is very difficult for healing to take place. Then his own expectations of improvement due to the treatment which is being offered to him, if it is good, then only the healing will take faster, otherwise it would take time. Next is therapist related factors. See, here also the positive nature of the therapist will also help in healing, and also the absence of the unresolved emotional conflict. At times all therapists are also human, but they have to keep when they are attending to their clients, they have to keep their emotional conflicts aside. So a lot of things will affect the healing. Now let's have a look on the ethics quickly. See, informed consent need to be taken. Okay, client should be informed about the therapy. Then confidentiality should be maintained. Then the goal of the therapist should always be alleviating the personal distress. He should be able to maintain his own integrity, which is very important for the relationship for good therapeutic alliance. Then professional competence and skills are very much essential. Next let's talk about a small topic in your syllabus, that is the last topic, rehabilitation of mentally ill. See, this means to empower the patient to become the productive member of the society to whichever extent it is possible. So in this rehabilitation, the patient is given occupational therapy or social skill training or vocational therapy through the activities. Like in occupational therapy, what we teach the patient is like activities like candle making, paper bag making, etc. And in social skill training, the patient is given role play or imitation, so that his communication skills should be developed. And then in cognitive, for vocational therapy, the training is given in helping the individual to gain some employment somewhere. Okay. Now in the next video I will be talking about all the 4 therapies which are in your syllabus, and hope this video helps you in quick revision for your upcoming exam. Best of luck everyone. Thank you.